Perfect. Thank you. Welcome everyone to the second meeting of the COP, the Digital Food Retail Environment, COP of Researchers. Before I begin, I'd like to do the acknowledgement of the country. So I acknowledge the elders past, present, and emerging of all the land we work and live on and their ancestral spirits with gratitude and respect, and to recognize their continuing connection to land, water, and community. I also pay my respects to other Aboriginal and Torres Strait Islander people present, and I'm joining in from the lands of Wiradjuri people. So I was expecting there might be some new members in today. I don't see any new members in. So if not, before I kick off with the actions from our last meeting, does anyone have any updates they'd like to share with us regarding, say, new projects, existing projects, any milestones reached, new grants, or anything really? Or I'm happy to come back to this at the end of the meeting if something pops up in your head. Anything anyone likes to share? Go ahead with.
I think Cindy can talk about the MRFF we're putting in.
Oh, we're talking about that one already?
The one that's just been put on paper and is now a real thing.
Yeah, it's not really digital. Oh, I suppose it is. Yeah. Oh, well, we're Laura, Christina, Jane, Jacobs and I are looking to submit an ECR MRFF grant, which would look to developing an online digital platform for engaging with communities to understand how they interact with the food environment, and also, I suppose, gather barriers and facilitators and help generate solutions through sort of a digital GMB kind of process using Sticky. So we use sort of a GMB approach, but also a participatory mapping approach, where we'll have sort of a digital map where people can indicate where they live and where they shop and how far they travel and where they think things could be if they were to improve the food environment. And we're submitting in partnership with Colac-Otway Shire and Tamworth local government, as well as their health services. So yeah, it's a pretty exciting project. It's a lot of work.
Yeah, that sounds exciting.
Interesting experience.
That's great. So to map where people are purchasing from, are you using any sort of spatial modeling, GIS or anything in it?
Yeah, we'll be using, particularly with the ArcGIS work that I've already done, we'll be doing some spatial analysis so we can understand where the people live in their food environment in terms of their access, particularly to healthy food. Yeah, so we'll be using either a Google Maps platform or an ArcGIS platform. It'll depend on what works best for the software developers. We'll be working with ISRI. I'm not sure if you guys know who ISRI is, but yeah, so the ISRI team, Michael Johnston and Douglas Creighton are on board as associate investigators as well. So they'll be helping heavily with the development of the software platform if it all gets up.
Fabulous. Sounds exciting. When does this go in?
21st of June.
Ah, not that far. You're almost started off with June.
Yeah.
That's great. All the very best. And
another one we could probably mention before we move forward as well is that the other project we're doing, the IHT project for the seed funding grant, we're going to be circulating a Delphi survey, depending on how long it takes for the ethics to get approved, but in the next month or two, I'd say, through a number of channels, through Refresh and Globe and Nourish Network, to look at classification of online food retail I'm going to say outlets, but that's not what we're really saying. Food retail opportunities that we've extracted from Uber Eats and Menulog. So yeah, look out for that one if you're interested in contributing to that project.
Yeah, that was really interesting because like Rebecca and Cindy have done so much work, and we try to classify all these outlets as like healthy or unhealthy, and we just got to a point where we're like, you cannot like classify an Indian restaurant as unhealthy. That's just like culturally inappropriate. There's so many nuances behind it. And so, yeah, I think they've done a great job in taking the next step to do a Delphi study and look at it properly.
And it's also really tricky because a lot of the classifications look at like the size of an outlet and whether you order at the front service counter and get served your food sitting down, or whether you take it and go sit down, and all of those kind of things, which for Menulog and Uber Eats, they don't count because you're just getting everything delivered. So yeah, it's just a different classification method. But Rebecca's done a lot of the hard work. I can't can't take all the credit for the Delphi stuff, but it'll be really exciting when we start getting that classification tool together. And we can actually classify the data, which we have thousands and thousands and thousands of data points to classify. So let's hope that'll be quick and easy.
Can I ask what health classification you guys are using?
That is, we based it sort of loosely around, actually, Rebecca, you might want to jump in. What was the one that the other classification?
Yeah, there was a study done by some people, I think from University of New South Wales, and they use it's called My Meals. I don't know if you've heard of that, Vic, but it's basically it's kind of, to me as a non-dietitian, it sounds kind of like dietitian-y talk, like, you know, talking about things in terms of like meat meals, like cereal meals, vegetable meals, you know, desserts and baked goods, like all these kind of categories, and then the menu items kind of fit within those. And so we've got like an outlet type, and then all these names and examples, like, you know, cereal mixed meal might be like a burger, you know, meat mixed meal might be like grilled chicken. And so you can kind of see, yeah.
And is it a traffic light system? And sorry, if we're going outside the agenda, this is always the $1 million question. And Vic Health said to me, you know, how do you define an outlet as healthy? So I'm super interested in, you know, learning more about what you're describing.
Well, that's what we kind of, what we want from the Delphi study. So we've got a scale from -10, which is least healthy, to 10+, which is most healthy. And so we want, we've got, I think, how many, is it like 40 outlet types, Cindy, approximately?
Okay.
So for people to go through all these outlet types, so something like, you know, a supermarket, you might think, okay, you know, +8, whereas like, you know, franchise, fast food, I don't know, -8. And so just to kind of, you know, relative to each other, come up with a ranking.
Okay, so it's not micronutrient based, like, you know, you
No.
said Indian food is amazing from a whole food perspective, but it could have high sodium.
We're sort of, one of the things that I, through my other work through food retail, like physical food retail, and now obviously looking at this one, is that we need to look at, I suppose, when we're looking at scale and we're looking at the whole of Victoria, it's impossible to
100%
go through the micronutrients. So we're looking for, I suppose, a generalized classification of healthiness based on the overall product availability. So I suppose it's, it can't be down to exactly some calculation on their menu, but it'll be sort of a more generalized
broad brush. Okay, thanks.
Fabulous. Sounds so good. And I'm so looking forward to hearing more about it as the study progresses. That's great. So moving on, not sure if you had a chance to look at the TOR, the term of reference for this COP. So I can give you a brief firstly, have you had a chance to look at it? All right. So I can give a little bit of update about how and where we are at this. So in the last meeting, there was a suggestion to add an equity lens to our the work we had proposed in terms of our strategic vision, aims, and objectives, which we had amended. And that's all fine. That's in there. But if there's anything else that needs to be done, to let us know. At a recent Nourish Network exec meeting, I can give you an update that there was a suggestion to include the advocacy and communication into the TOR, but I think it's still in progress to see how best we can embed that into the TOR to sort of get the advocacy and communication going, because there's another interest group led by Emily on the advocacy that might be very useful for all the other COPs and special interest groups. So we're still looking into how we can best embed that. I'm not sure if you've noticed, we're now calling this as COP of researchers. So this was another suggestion that came from the Nourish Network Exec Committee, primarily for the reason that this field is evolving and we are still keen to generate scientific research evidence before we can bring in retailers on board for practical application. So the idea is to grow this group of researchers with researchers across Australia and New Zealand, and then probably even go beyond that. And at some point in time, we would then have retailers on board to sort of do our run with the practical application of what we've generated in terms of evidence. So that's been the latest update into this COP. Any thoughts, anyone? Any questions? And feel free to keep asking questions as we go along if you have any. And all these documents are within the team site, so easy to access. And yeah, you can have a look at that too. Yeah, Tailani, did you want to say something?
Yeah, you mentioned that the copy is not only aimed to researchers. Do you have plans to invite anyone else from other areas to join the group?
You mean researchers?
Not researchers, because you mentioned it's not going to be aimed only for researchers, right? Or did
Yeah,
I
so
understand that
yeah,
wrong?
but for now, I think what the committee suggested, the exec committee suggested, is to just keep it to the researchers,
Or just
because we
keep
want to
it?
generate more evidence, understand this platform a little more better before we can spread out and have retailers on board to understand what can be done on this particular platform and to the entire sort of digital food retail environment space. So I guess in my last sort of before I close the meeting, there would be some ideas about how we can expand this group and include more researchers in there. So I'll touch on that again later. Any question, any thoughts, anyone, before I move on to the next item in the agenda? All right, so we are right on time. And so next, what we've done is we've organized a format where at each meeting, we're planning to have some presentations to showcase the work happening in the digital food retail environment space. And at this meeting, myself, and thank you, Rebecca, for agreeing to present as well. So me and Rebecca would be talking about some of our work, and I'll be seeking in volunteers to nominate themselves for the next meeting. So feel free to let me know now or later via email if you're interested in presenting. So without any delay, I'll kick off the meeting and I'll share my presentation. And we've kept it like I would be presenting for approximately 10 minutes or less maybe. And this will be followed by Rebecca's presentation. And then we've kept some time aside at the end for a discussion on the two presentations and anything else further that we'd like to talk about. All right, so I will just share my screen quickly. All right, can you see my presentation screen? Yep, perfect, thank you. So I'll broadly be talking about my Big Health Fellowship that I've proposed, and that would kick off in October this year. So the fellowship is on looking at the impact of online food delivery services on youth's food choices. So we know that less healthy diet is a leading risk factor for non-communicable diseases, and we also know that food environment plays a vital role in determining populations' dietary choices and health outcomes, which includes both physical and online food retail environment. And the focus today would be on the online food retail environment, as online forms of selling and purchasing food are gradually replacing the traditional forms of food purchasing. And my work sits in the middle green box here, which is the online food delivery services, to generate evidence to understand its impact, public health impact of the online food delivery services. Yep. So, and to do so, there is a need to understand more about the platform before we know what to do and how to act on it. So I guess the key questions here are, what is an online food delivery platform? How does it work? And why is this a problem? Okay, so I'm sure you all know what is an online food delivery service or a platform, and you also know how does it work. But in brief, it is a platform that is defined as either a website or a smartphone application that allows customers to order menu items from food outlets for pickup or delivery by freelance couriers. And to access these services, customers create a personal account with a credit or a debit card details for automated payments and the delivery address. So if a customer selects delivery, they can generally track their progress of their order on the website or the app. Moving on to why is OFD a problem, why these platforms or services are a problem. We know its use is rapidly increasing, and post-COVID, along with the increased access to internet and mobile phones, it has escalated its use. It's expanding our food choices beyond the local food that we had initially. There is intensive food marketing strategies on this platform to influence purchase and consumption. And there's also recent evidence to suggest that youth and young adults are amongst the highest users of this platform. and nearly 86% of the popular food outlets on these platforms are unhealthy and classified as discretionary foods. But digital food retail environments, I think, because it's still evolving, it provides lots of opportunities and it has its challenges for the food choices to influence health and nutrition. So amongst the challenges, I think the biggest challenge here is it's largely unregulated space, and it raises concerns for its public health impact on both diet and health. The big data are shaping our contemporary marketing practices by continuously monitoring our habits and browsing history. Populations have now a very strong online presence. There is a growing purchase power, and this is viewed by digital marketers as a very lucrative market segment. But nonetheless, there are opportunities that we can tap on this space is to firstly understand and map the online food landscape. We have an opportunity to engage consumers into this and have an interaction with them along about the platform and understand how they engage with the platform. There's an opportunity to partner with multiple stakeholders, such as platform providers, developers, policymakers. There's an opportunity to develop tools to implement, evaluate, monitor the online food marketing on this particular platform. And definitely there's a need for sort of generating evidence to call for more regulation on this particular platform. So with that, I aim to investigate in my fellowship to investigate the impact of online food delivery platforms on the youth's food choices using mixed methods. So the studies here will investigate how food marketing techniques are used within the online food delivery platforms, how youth engages with these platforms, and how this influences their food purchasing decisions. And through youth-led co-design approach, I aim to generate solutions to enhance the healthiness of food purchased using online food delivery platforms. And especially the real-time engagement, that would be very key to this particular project in order to understand how youth engage, how much time are they spending, what are they really viewing when they are on this particular platform. And this would be done through an online screen capture methodology. Yeah, so that's all about the fellowship. But yeah, before I close, so there are certain desired outcomes that I would like to achieve from this fellowship or see as coming out of the fellowship. So these are firstly providing foundational evidence to promote healthy online food choices, support government policy and advocacy, and reduce inequities. Better understand the social and commercial drivers of online food delivery platform use. Identify simple, low-cost, yet impactful interventions to reduce unhealthy food marketing on the online food delivery platforms that then empower young adults to make healthy food choices. Create opportunities to partner with, like I said, multiple stakeholders, platform providers, developers, policymakers. Establish the need for regulation and monitoring of online food delivery platforms, particularly when their targeted marketing approaches are being applied to certain groups. And of course, create opportunities for future research and policy in the digital food environment space, both in the short and long term. So that brings me to the end of my presentation. Thank you, and I will stop sharing my screen. How do I stop sharing my screen? Stop sharing. So yeah, thank you for that. That was me. I would now like to invite Rebecca to present some of her work from her PhD that she'd like to share with us. Thank you, Rebecca. Over to you.
Okay, can everybody see that one? I do have a bit of a cold as well, so I apologize if I sound a bit blocked up. So thanks, Adia, for inviting me to speak today. So I'm going to be talking about a study that's part of my PhD, which was an interview study that I did with online grocery shoppers. So some background before we get started. So as we know, supermarkets are where the majority of food purchasing happens in Australia. And as such, they have a huge influence over what we eat and our purchasing habits. So lots of previous studies have examined in detail strategies used by supermarkets in store to influence purchasing. So things like end of aisle displays, visual merchandising, store layout, signage, stuff like that. But with the COVID-19 pandemic, obviously there's been a huge shift in the way that we purchase food, not just in Australia, but worldwide, because people didn't want to go into supermarkets because they were worried about catching the virus. So in Australia, between October 2019 and October 2020, there was a 160% rise in online purchasing of food, which includes online grocery. So as digital food retail environments are becoming more popular, it's important for us to understand the techniques and strategies that are used by online supermarkets to influence our purchasing, just like we understand them for in-store supermarkets. So our study aimed to firstly understand the perceived influences of online grocery retail platforms on healthy and less healthy food purchases. Also to understand shoppers' perceptions of how online grocery retail environments could better support them to make healthier purchasing. And also to understand how these perceptions differ for high and low socioeconomic groups. So onto the methods. We used a qualitative descriptive study design to gain an in-depth understanding of shoppers' perceptions of online grocery retail environments by conducting semi-structured interviews. Inclusion criteria to participate was that they were a parent or carer of a school-aged child, and they used online grocery shopping at least once per fortnight. Participants were recruited using a paid recruitment company located in Melbourne, and every participant received a $50 supermarket gift card to compensate them for their time. All interviews were conducted by me over Zoom, and an audio-only recording was made for transcription purposes. The marketing mix model, which is the 4 Ps, price, promotion, product, and place, was used as a theoretical basis for the formulation of the interview guide and also for the initial deductive analysis. A combination of deductive and inductive analysis was undertaken to code data using methods outlined by Brown and Clark, and data was managed and analysed using in vivo. So 16 interviews were conducted, mostly with parents of school-aged children, but there was also 2 grandparent carers who participated. So I'll firstly discuss the themes that relate to the influence of purchasing according to the marketing mix. So for promotion, so participants felt that online marketing for unhealthy food and drinks was too prominent compared to marketing for healthy food. They discussed how they perceived that supermarkets' websites were prompting them to look at price promotions by featuring large website banners on the online grocery shopping homepage, which advertised discounted products, and having the specials tab at the top of every page. There were mixed opinions on whether price promotions were more visible in store or online, with some participants commenting that they found them more visible online and some believing they were easier to find in store. But importantly, price promotions being less visible was perceived negatively, with most people finding them useful to help them save money. Most participants discussed using the online version of the supermarket catalogue when completing their online shop, specifically to try and find price-promoted food and beverages. This was emphasised by participants on a low income, particularly how reading through the online catalogue was usually one of the first things they did when deciding what to buy. The online catalogue was also viewed as useful as participants can click on an item in the catalogue and add it directly to their online cart, which they said saved time. Similarly, using the specials tab on the website to find price promotions was also a common way to begin planning their online shop. Most participants agreed that online shopping reduced their impulse buying compared to shopping in store, and that shopping online allowed them a greater deal of control over their purchases. However, some participants described that they bought a greater number of impulse items when they were shopping online because they had more time when they were doing their online grocery shopping, and they had a greater ability to browse to find extra products. In-store marketing for price promotions and unhealthy food was described as more visible and obvious compared to online grocery marketing techniques. Price. So price was described as a key motivator when deciding what to purchase online. Healthy food was consistently perceived as being more expensive than unhealthy food, partly because it's uncommon to find healthy food on price promotion. Most participants discussed how it was easier to stay in their budget and keep track of their spending when they were shopping online, and sorting results by unit price allowed them to select the cheapest items, which they found useful for staples like milk. Most participants described some method of pre-planning their online grocery shop as a method to save money, whether that be using a physical shopping list, using a list-making app, or just adding things to their online cart as they thought of them. Participants discussed how they were methodical in their online shopping and they followed a routine. They extensively used the bought before list generated by the supermarkets to check and also check their home inventory of products before beginning their shop to ensure they didn't overpurchase. They perceived that online grocery shopping allowed them to plan more carefully what they wanted to buy compared to shopping in store, and it helped to manage their spending. Some participants reported that they spent more money shopping online compared to in-store. Others reported they spent less money shopping online, but participants with higher incomes were more likely to comment that they spent less money online. Place. So most participants described how they didn't solely shop online for groceries, but they also shopped in-store. Most commonly, they discussed how they preferred to shop in-store for delicate or perishable items because they really placed a lot of value in being able to physically inspect these items before purchasing. So these perceptions did not vary across socioeconomic groups. Most participants expressed that they only bought perishable items online if they had no time to shop in store, and they usually preferred to buy minimal fruit and vegetables online. Almost all participants agreed that it's harder to search for healthy food online compared to in-store, and they described how searching for healthy food online was more time-consuming than when shopping in-store. Participants believe that physically seeing fresh fruit and vegetables in-store helped to put them in a healthier mindset, which also influenced their later purchasing. Participants also commented that the in-store marketing techniques used for fruit and vegetables, like store layout and vibrant colours and things like this, also influenced them to buy more fruit and vegetables in-store than online. Having healthy fruit and vegetables immediately visible to them was described as a purchasing trigger. Participants generally reported they found it easier to read nutritional information in-store rather than online. Finding allergen and country of origin information online was described as difficult, and participants also described how it's hard to locate nutritional information online, and if they did locate it, it was often incomplete or missing. Additionally, participants who use their mobile phone to do their online grocery shopping said that these nutritional information photos are often really small and hard to read on a mobile phone. Using online grocery platforms instead of shopping in store was generally reported to save parents and carers time because they didn't need to bring their children with them, and taking children in store to shop was described as time-consuming and unenjoyable. So what do participants think could be done to improve the healthiness of online supermarkets? So I've split these into supermarket-led actions and government-led actions. So we'll begin with supermarket-led. So overall, participants had a perception that supermarkets were simply trying to make money and were more concerned about profits than about the healthiness of the products that they sold. Participants also reported being wary of healthy product promotions or suggestions from online supermarkets, as they believe that supermarkets are not objective in their assessment of what is healthy and they are influenced by their relationship with suppliers. Participants felt strongly that supermarkets could and should do more to place online price promotion discounts on healthy food, and they sold too much unhealthy food. They also agreed that healthier food and drink should be easier to find when they were shopping online. Some specific initiatives to improve the healthiness of supermarkets online were filters or specific categories for unhealthy food, so it was easier for them to avoid seeing them when they were doing their online shopping. And participants also suggested being able to filter products by health star rating or optimizing search results, so healthier products were higher in the search results would help them to choose healthier products. And the online catalogue was also perceived as a potential way to promote in-season fruit and vegetables and have price promotions on these types of things. So government-led actions. Overall, most participants agreed there was a role for government to regulate online supermarkets' ability to promote and market unhealthy food. Participants believed that regulations to restrict unhealthy food marketing through online supermarkets was in the national interest due to unhealthy diets increasing healthcare costs. Many participants also suggested that a government-led general healthy eating campaign or awareness campaign could be useful to help people choose healthier foods when they shop online. And participants suggested that some people might have a misunderstanding of what healthy food is, and therefore some kind of education campaign could be helpful. A government policy to reduce the cost of healthy food relative to unhealthy food was also suggested. So discussion. So this is a first study to examine the influence that online grocery retail platforms have on purchasing behaviour compared to in-store, and also to discuss what participants think could be done to improve the healthiness of these platforms. So we found generally participants reported that purchasing healthy food is harder online than it is in-store. Previous studies have shown that generally online grocery retail is perceived as a health promoting retail space because there's an absence of in-store marketing online. There's been some previous work kind of agreeing with this. So a 2019 study by Dillahunt found that intervention group participants who were given access to online grocery deliveries purchased a greater percentage of healthy food compared to people who shopped in store. And also a study by Huey found that shoppers spent less on vice items, which were chocolate, chips, and salty snacks, when they shopped online compared to in-store. However, the results of our study don't entirely agree that online grocery retail platforms are only a health promoting retail space, with some participants discussing purchasing greater amounts of unhealthy impulse buy products when they shop online, and also that they have a greater time to read the online catalogue to look for price promotions. Some participants also commented that when they shopped in store, they found that helped them to buy healthier food and drinks because physically seeing fresh fruit and vegetables online in store helped put them in a mindset which also influenced their other purchasing. Additionally, there was a lot of discussion among participants about this kind of hybrid model of shopping where they're shopping in store and they're shopping online. So really they're being exposed to two lots of marketing now. We have the in-store marketing and we also have the online marketing influencing purchasing. So previous studies have described the availability of nutritional information online as being inconsistent and missing for essential items. But our study found that participants don't really read nutritional information online, preferring to find this information in store. So difficulties in finding nutritional information online and also difficulties in making the images large enough to read and missing nutritional information are all barriers for them accessing this information online. And although most of our participants were in favour of greater regulation of online supermarkets, they generally found it hard to think of ways that online supermarkets specifically could be better regulated to improve the food environment. And this could be just because online supermarket platforms are pretty new and participants don't have a lot of experience with using them. When we were talking about in-store marketing with them, they're all very familiar with that. They understand how it works, but the online side of the marketing, they're not as familiar with it. So I think it's hard for them to think of ways to regulate these environments. Sorry, my voice. So just to sum up the key messages from the study. So basically participants found it harder to buy healthy food online compared to in-store. And although they found it difficult to think of ways specifically for government to improve the healthiness of online supermarkets, most participants were in favour of some kind of government intervention. Thank you.
Thanks, Rebecca. That was wonderful. I open the floor now. If anyone has any questions for myself or Rebecca, please, this is the time to discuss. Any questions? Yes, Gary.
Thanks, Rebecca and Nadia, for your presentations. I just want to make, I mean this in a really, really friendly way. But for both of you, this is just a small group of essentially friends, and you both presented in a really academic style. In a group like this, I think we should practice just chatting to each other. Like, why do you say we had 43 participants, 7 of which were female? Like why say that? We're just friends chatting. Just say, yeah. So look, for the survey, 46 people filled it out. Like, I don't know, just talk. Like, don't be all academic. I think it's really important, actually. I mean, it's different if we were practicing, if this was a practice for a conference presentation, and then you can do it in that style. But like, it's all so formal. Anyway, just wanted to say that. I don't know if others think I'm being an arsehole saying that, but I don't know. I just. Yeah.
Thanks,
My
Gary.
perceptions. Oh, sorry, Gary. I was going to say my
Go ahead.
perceptions are maybe EMCRs want that practice, but that's just my perceptions. And also, I think Vic Health, the COP, it would be really great for them in that format. So, but that doesn't address your point, Gary. Aja?
Yeah, I was just saying that's a great feedback, Gary, because this is going to be like COP of researchers. And of course, we are like all within Globe at the moment. We haven't really expanded. So I think it's a great idea actually to have this conversation and discussion, because we want to make sure this COP and this group sort of addresses what we want to see in future, right? We don't want to have it in a format that not everyone likes or not everyone sort of appreciates or not everyone's so we want to try and incorporate everyone's perceptions and preferences within this platform. So great feedback, Gary, thank you for that. And yeah, we'll I guess our next speakers have something to think about when they nominate themselves to present at the next meeting.
I think it does take time though to get there, and I think yeah, like we often forget what it's like to be a PhD student or someone who's like only done a handful of presentations in their lives and is probably a bit nervous about the content. But I agree, like casual conversations are always, you know, more engaging, but yeah, it does take time and practice to get there.
Also to add, I think we're always running after perfection. So trying not to miss any point, not to miss anything very critical in terms of like how Rebecca mentioned about participants and everyone. So we're just trying to make sure we capture everything in there. So that just makes it a bit more academic, I guess.
So maybe what we could do is just differentiate between, if someone wants to practice a presentation for a conference, then they can say that and say, look, I prepared these slides for a conference and I'd like to try it out with you. That's different to, hey, like this is what I'm doing, and yeah, here's some stuff I found. I just want to get your thoughts on it. Which actually, I think both of your presentations were more of that kind. Like you weren't practicing for a talk there, and so I think you'll engage more with us if you can just do it way more casually. Is I don't know. But I think they're different styles. Yeah.
Now that's a great feedback, Gary. Thank you for that. I will add that into the minutes, and I'm sure, yeah, we'll keep that in mind for next time moving forward.
On the topic of conferences, Rebecca, have you submitted that anywhere? Like, it's definitely timely to put it into one of the national and international conferences next year.
Yeah, I was going to submit it to ANZOS. That's kind of as far as I've thought about it. Yeah.
Yeah, cool. And I saw with ANZOS, like they've put another call out for, I think it's too early for this group, but I think next year, like there's a handful of international conferences, like the World Public Health and Nutrition Conference or whatever. I wonder if it's worth this group thinking about what like a symposium or something would look like, where we really showcase the different projects that the group are doing.
I think that's a great idea, Christina. I'd been thinking about ANZOS, but again, I pulled back because of the reason that it's very new and recent that we've just started. But yeah, great suggestion. And I think we should definitely think about this, more.
I was wondering if you, Adia or Rebecca, have explored anything related to the personalization that the participants experience when they access the online stores.
Do you want to go first, Adia, or do you want me to answer
I'm
that?
happy for you to take, yeah.
Okay.
Because I
So
haven't really started mine. So yeah, it'll be like what I would be planning to do. But yeah, go ahead, Rebecca.
So I did have some questions in my interviews, Taylani, about experience with personalized marketing online, and definitely people talked about they had experienced it, specifically if you're a member of you have an account with the online supermarkets, they send you a list every week of price promotions that are based on your previous purchasing. And, everybody loves it. It's, the best thing ever. If you ask the participants, they think it's like wonderful. So they were talking about that. They're also talking about how when you do a search, now there's promoted items in the search results as well. So it's, say you put in milk or whatever, the first result is sometimes something completely random, like a chocolate milk that's being promoted by the algorithm to you. And so they had definitely noticed that, but all of them said they were either just ignored it and they didn't let it influence them at all, or they said they noticed it and they found it annoying, and it kind of contributed to this feeling of distrust that they had with the online supermarkets. Like they felt like they were getting this product pushed on them, and it was a more expensive product. Usually it's like a brand name product, and they didn't like that. They, it definitely was like a negative experience for them.
Thanks, Rebecca. And for my fellowship, I think this is going to be a very key component to understand the personalized messaging on the online food delivery platforms. Because once you are registered as a user or as a consumer on that platform, you kind of start getting very targeted messages depending upon your history in terms of what you've ordered, and when it's time you look through the menu items and the restaurants and stuff. So through the real-time engagement, the second part of the study, where I'll be engaging into how consumers are browsing through the web, through the online food delivery apps. What are they really looking at? What are the notifications that are being popped up for certain groups, and how is it different for different people? So it's going to be, it's going to be very much focused on how the personalized marketing is being put out in the online food delivery platforms.
Yeah, that's great. I think that's a major component. I was just thinking about my experience a few days ago, because I don't usually shop online, but then my partner decided to shop once, and he bought like a Coke for the first time ever. And now every time I enter like Kohl's online shopping, it's all about Coke, all in my page. Like even if I go to like vegetables, they pop up a message, do you want to buy a Coke? So I was thinking it would be good to understand like the mechanism behind how this promotion is targeted to the participants.
Yeah, I had a similar experience, Taylani. I bought all these little fun-sized chocolates for party bags for my son's birthday, and now every time I do anything with Coles, it's like Freddo Frogs on special every time. So yeah, it's very annoying.
It is.
Very interesting to understand what sort of algorithms go behind all of this, and how it's actually, how the targeting is actually done. So maybe very interesting to get in touch with some, I don't know, insiders on this, in terms of, who's previously worked with these platforms and know really how this happens. So getting on board some developers and, technicians from the platform per se, and working with them would be very interesting.
Or even, I know Josie loves reading the industry reports. I'm sure somewhere in like their industry reports, they're talking about how they're giving customers what they want by doing this personalization stuff, and what algorithms they're using.
Great, thank you. Any other questions, anyone?
Aja,
Yes.
I know this touches on, that it's a research practice group, it's informal, but would you think about presenters, either, like you said, maybe the industry people or someone like Bill Bizos from Skip, who could then just come and present to give a bit of an overview? So they're not strictly part of your group, but they might help inform or give you some ideas.
Absolutely, Vic. I think it would be great to learn what's happening at the other side. I'm just not too sure how much value they would see in doing that. Like what do we have in there to offer them?
I think
But
if they're just coming along to present, they always want to expand their sort of engagement audience anyway, but you could always, or I could ask the question if you
totally.
like.
Yeah, that would be very cool to actually hear from them. How's this
Mm.
platform, evolving and developing and emerging, and so absolutely open for that too. Any other questions? Anyone? All right.
Not really a question, but I was just wondering, like, because we are all researchers and we kind of investigated the same topic in different ways, would it be possible to kind of develop a live document or something when you can maybe map some gaps or projects that we are interested on, and then we can collaborate it to put applications about that?
Yes, great thought, Tailani. Thank you for that. I think there's a document that I put in the Teams, just mapping what everyone's working on. But of course, there's a possibility to expand on that to identify the commonalities and where we want to sort of work together and develop new ideas and new projects. And that's, I think, one of the also aims that I might actually talk now, because that's in my next sort of agenda item, to think about how do we plan a research project that interests everyone, that we can all work through together on, and has a common objective that not just serves an individual's purpose, but the entire group's purpose, in order to understand this online food environment more broadly. So that was another sort of a thought that we should now sort of start thinking about. Is there a project in mind that anyone wants to lead and people want to jump in, and or we want to develop something altogether new in terms of, coming together, having some brainstorm discussions. There are options of getting some like a Trello board kind of a thing where we can all map different items that we're interested in, different aspects and topics, and then we can all collate it together and see what are the common themes coming out and what's the most sort of interesting and I guess most foundational kind of work that we want to do in the space to inform future research and future policies and stuff. So yeah, that's definitely what we want to see in the sort of this growing in this particular community of practice group. So of course, very open to any thoughts, any suggestions. Anyone who's done this before in different other COP or interest groups, very happy to take your suggestions on board. Yeah.
Adja, we only have Deacon people here. Is that
yes? So
is that the plan, or are we planning to be?
No. So okay, so I might just move into my next agenda item that also talks about how we want to see this group moving forward. So I guess my next request to all of you would be, how about each of us nominate a new member who's not from this group. If from this group we're missing someone, we're most welcome to bring them on board. But broadly, like from Australia to start off with, if there's anyone who's working in this space, we know we have a few colleagues who are working across in Sydney and different other states. How about each of us invite one more member? And this is how like we grow as a group of researchers, firstly probably in Australia, then go beyond New Zealand, and then beyond Australia, beyond Australia, New Zealand. And so that's one of the plans of how to grow in this group and how to see what's happening in different other states, different other parts of the world as well in that sense. And yeah, is that what you meant, Carrie?
Yeah, I think it's a great idea to try and expand, and definitely I don't think there's a reason to keep it exclusive. So yeah.
Absolutely. I think it was just a matter of coincidence. It became very exclusive. It wasn't meant to be. There was a call out of people and stuff, but then we've just identified there's heaps of interest from within the group, and we didn't really know what each of us were working on. So the idea was, let's just start from internal and then go bigger and broader. So yeah. So I guess the next
so
steps.
Ajay, if I wanted to invite someone, or just tell them about it and say they might be interested in joining. Do we have something to send, or is it just the invite to the next meeting, or like what do we do?
Absolutely, Carrie, most welcome to involve and invite anyone that you feel is going to have a great sort of learning for themselves and for the group. I think what Vic has been doing is she's been putting a little blurb about what the group is and what the group aims to sort of achieve. And I think that's something that could be, sent across just to give a, bit of an understanding about, what is this group? What are we doing? What are we trying to get out of this? And along with some links of, if they want to know more about. Vic, do you want to say anything if I've missed out on anything of how to?
Yep. So there's always a landing page on the website, which people can go to see in detail what it's more about. But I think an engaging graphic seems to work really well, even for researchers who, do like that bit of detail. So I would encourage maybe a bit of a flyer or some sort of graphic to go out more broadly to communicate and raise awareness on the group. And then the joining is just literally going to the website, and that person will email Ajay. So that's what we've been doing so far, but obviously open to suggestion on other ways. I think your networks, Gary, is a really good, and everyone else is a good way, rather than just yet more broad communications. So maybe if we put that sort of imaging or whatever flyer thing together, and then if you guys share it and it's coming from you, I think that's probably the best way forward.
I reckon it's enough to just the link on the web page, just we can take that blurb. I don't think we need a flyer, like, because someone's then going to make the flyer. Yeah.
Well, that would probably have to be our job, but yeah, if it's more of a personalized research network, the link on the website. Feel free to do that.
Going back to your point about collaboration, Adia, one thing we could do is think about putting together like a comment or perspective on the topic, where you do exactly what you said, and you aim for like a high impact journal to like build everyone's track at the same time and position yourself as a leader in the field by saying, this is what we know, this is what we don't know, and this is the stuff we need to like be exploring.
Yeah, that's a
And
great idea.
they're not that hard to write. Like, look how many of us there are. You can have as many authors as you want. It's 1,500 words. Make it fun.
That's a great idea, Christina, actually.
I should probably mention we have prepared an evidence summary on this topic for the Refresh series. I don't know, Claude, if you want to talk a little bit more about that. You are the lead author of that summary.
Yeah, so there was I can't remember now. Yeah, I don't think we reached everyone. Actually, I should probably have like emailed the group, but yeah, Adia and Rebecca were also involved there. I think it's different from the commentary though, because it's like quite small. It's like a 1 page, so it's really like, you know, such a broad topic. And also, you know, there's like within the online, there's like the supermarkets, the outlets, and you cannot really talk about all of it together. So it was a very like, you know, broad perspective, I think, more about the online space, which, I mean, it can be like a good start to have like a picture, but yeah, I think there's potential to do the commentary and like expand on that, and more specifically, you know, talk about research gaps and what we know or what we don't know. Although there was also a thing from the like the prevention center.
So I can add to that. So there's this EOI open. There was an EOI open from series, this prevention center series, that aimed at putting in some perspective pieces and original pieces in the Public Health Practice Journal, which is not a like Q1, it's a Q2 journal, but then perfectly fine for like the perspective pieces, in my opinion. So I had put in an EOI with the members of the series and other CREs as well across, who are jointly within the series group as well. So that perspective piece, I'm not too sure if they've sanctioned it, like approved it or not at the moment, but that was a perspective piece I'd put to talk about more broadly on the digital food retail environment. And like you said, Christina, about what are the gaps in the space and what do we want to achieve from that. So if that gets up and I get an opportunity to write that, I might ask them if I can also include, you know, people from this group who may not be member of series. I don't know what's the condition there. Do you have to be a member of series or not? I know you have to be a member of the CRE that is a part of the series. So I can work that out, and I can check around the membership there and see how we can go about it. But that was something that I had been thinking. So not too sure if it's got up or not. We still are waiting to hear back from what we put in. So yeah, but nonetheless, it's a great idea. If that doesn't get up, we should definitely start thinking about doing this in some other, probably a good journal then. Great. Any other thoughts, anyone? All right. So I guess our next steps, so we're very close to finishing, 4 minutes. Should have been already 10:55, but then quickly. So next steps from here are probably just to finalizing our terms of reference. So it would be a great help if you could all look at the terms of reference, and if there's anything striking in there that you think we're missing, would be great to know, and I could then feed back to the exec committee on how we want to expand and add on things. So in the agenda, I mentioned I would request 2 volunteers to nominate themselves for the presentation at the next meeting. I suspect Cindy would like to take an opportunity to present, but anyone else other than Cindy along with Cindy, who would like to sort of present. Thanks, Cindy. Please feel free to email me or let me know if you're interested. Otherwise, I might just pick up anyone.
Sorry, when is the next
It's going to be
meeting?
in 2 months' time, 1st September.
Okay.
So any project updates, anything, and informally, unless you're presenting to a conference.
I was thinking like it might be good to, because I mentioned before, like the within the Informas retail module, like we are doing this like online grocery monitoring tool that like we are planning to pilot test as well. So it will probably be good to kind of share that with the group as well and see what everyone
that would be fabulous
feedback is. And I think it's interesting because even like listening to your presentations now, it's like a very tricky space to monitor, because even if you can find the the nutrition information, like it's there, but how do you actually monitor if it's like easy to find or like things like that? So yeah, that could be good.
No, absolutely. And it'll be so cool to actually bring in all projects together and then come up with something in terms of, this is what's needed and this is how it is to be done, what learnings we can get from different other projects. So absolutely. So are you happy for me to write down your name for the next meeting in case if anything changes or anyone else wants to pitch in something? Given it's going to be informal, I'm happy for more than 2 people to sort of, share their topics and works and any progress happening until then. The other bit was just to invite other members. So if each one of you could nominate or invite, one person from across Australia, New Zealand, or even beyond. So more than happy to do that. So yes, I guess in the next meeting, we'll see a much bigger group in that sense. And so also just to add, if you can also think about a plan on a project, like we thought about the perspective piece. Now, how do we go about it? Something on those lines, if you could have a think about what do we want to do as a group together, that would be fabulous. I guess that's all I had for my last item. Nothing really. Anyone wants to add anything before I close the meeting? And 1 minute to go.
Just to throw in a last minute idea. Gary, you know how you, Kath and Adrian wrote that piece on price motions and potential policy regulation options in like current nutrition reports? There could be an opportunity to do something like that. Like, what does it actually look like to regulate this space and what real world examples can we draw upon? Because I think like it's very good and well to do this research, but my brain still struggles at that point. Like if you go to government, what do you actually tell them to do? Because it seems so like unwieldy.
Yeah, I think that journal, so Adrian and Kath are on the like editorial board of it, and so they can commission papers if we and it's supposed to be just a narrative review of the topic and kind of suggestions for future direction. So I think that could be a good option. What it does is then force you to really think about it, because as you say, Christine, I don't think right now we actually know what we're asking for. So I mean, we could get in touch with Adrian and Catherine and say, well, how do we get a paper commissioned? And you can ask for like a year's lead time, so it would give us some time to actually work our shit out about what we want to say. Yeah,
I'll circulate that paper for those that haven't seen it.
Thanks, Christina. Thanks, Gary, on that. All right. Any other thoughts? Gary, you would like to say something?
Sorry, I just wanted to ask, like, for like nominate someone else. I was just because if like the idea was that each one of us is just going to email someone and like tell them about this, right? But then I was thinking, like, should we maybe say like email each other? Because then what if I kind of like reach out to the same people that Tailani does or something, and then people end up having like different people reaching out to them? Maybe we should like communicate between us first, or what do you?
Yeah, that's a great thought, actually. That didn't cross my mind. So thank you for picking that up, Clara. Let's put in a Excel sheet or something in the Teams side. I'll drop one and I will write each of our names, and then we can just write the name of the person that we'd like to invite. And if it's coinciding, we can try and look for someone else then, and then move ahead with that.
Good.
Perfect. Thank you all for your time, and see you all in September. Good luck with your projects. And as always, reach out if you have any questions. Thank you.
Bye.
See ya.
Thanks,
Bye.
Sadia.